So, someone asked this question: what can make a pregnant woman of 6 months to be having stomach pain every 2 days? Um, every 2 days at 6 months? Well, there are a lot of things that could be causing a pregnant woman to have, some pain. Uh, Number one, let's talk about normal pregnancy related causes. Okay, like stretching of some ligaments. So some ligaments around the uterus can, as the pregnancy increases, can, keep stretching. Okay, especially when there is movement of the baby and all that. And there is something called Braxton Hicks contraction in midwifery, and this, or some people call it practice contraction or false labor. Okay, these are like cramps that will come irregularly. Okay, they're not regular. Okay, and they come and they go. It's my last from seconds to up to 2 minutes, but sometimes changing position, drinking cold water, or doing anything can stop it, and it does not continue to lead into proper labor. So that's why it's called a false labor. It's just like your uterus practicing how they're going to do the normal labor when it starts. Okay, these are some of the things that can cause it. Another thing that might cause it might be digestive issues. Maybe there's constipation somewhere. Maybe because most times, some pregnant women will have constipation due to some hormonal changes and some iron supplements and all that, and also acid reflux and heartburn, due to the pressure of the growing uterus. So the size of the growing uterus sometimes can put pressure on the stomach, maybe causing some pain and discomfort. So another thing could be possible infection or complications of UTI. I mean, sorry, urinary tract infection. So urinary tract infection can cause some lower abdominal pain, like pain on the lower part of your tummy, and also you could feel some burning sensation when you're peeing, when you're urinating. And sometimes increase the frequency of urination, like you want to be peeing every time. Also GI infection, gastrointestinal infection. So this infection in your stomach, okay, infection in the stomach, in the stomach, and this might be maybe due to food poisoning or stomach bugs, and this, it can lead to maybe diarrhea, vomiting, cramps. That will be maybe from something we have eaten that the stomach is not accepting, and the stomach, to start causing pain, and sometimes the stomach will find a way to remove the ones they are not accepting. And then another thing that could be causing consistent pain like that could be preterm labor, like labor happening before the time you're expected to have the baby. So if the pain becomes persistent and regular, like if the pain is always there, increasing, especially the pain is going to your backside, and again you notice there is vaginal discharge or contractions, your increased contraction coming around, please check. You could be having early labor. Also, there is placental issues around the placenta. There's something called placenta previa and placenta abrupta. So any of these can cause pain, and sometimes it can lead to bleeding as well. But the thing is, in all these things I have said, the main thing is, what do you do when you feel pain during pregnancy? This kind of pain, please, One thing you would do is to observe the pattern of that pain. Is the pain mild? Does it go away, or is it always there? And then if it's mild and it comes, it goes, and then sometimes it comes again, it may be normal. It may be normal. Just try to drink water, change position. If there are things your body is not accepting, don't eat it, don't drink it. Just try and do the normal things. However, please, if the pain is not going away with the normal things you usually do to stop such pain, and they are not there, instead they are increasing, then you're having fever on top of it, there is bleeding, there's more contraction, please go and see your doctor. Do not treat yourself. See, you have carried this pregnancy to 6 months, 7 months, 4 months, whatever month. You have tried already. Do not do this yourself. Do not gamble it. And if I will tell you, do not look for, what people will tell you online, or what your friends will tell you. This could be the reason. I know sometimes it's money. It's money issue, especially when in a country where people don't have free medical access, so medical care. So I know sometimes it's the money. You're thinking of the money to eat, money to go and pay the hospital and all that. But hey, if you see, look at the precious child you're carrying. You have carried the child up to this point. Don't gamble it. You don't want anything to happen to the child or to yourself. So I will suggest, please pay a visit, urgent visit to your doctor. Let them have a look, do blood tests, scan you, assess you. At least they can rule certain things out, and probably, you guys can agree, or what might be the cause, and your mind will be at rest. Okay, don't gamble it. Don't treat yourself. Don't manage yourself when you're pregnant. It can get really worse if you don't visit a doctor and do what you're supposed to do. I wish you all the best, and I wish you safe birth when you are pregnant. And if you're still looking for a child, I wish you pregnancies as much as you want. I love you all. Don't forget to share our video. Thank you for watching, and I will see you in my next video.